Hey everyone, let's just dive right into it. Welcome to today's Explainer, where we are going to do a personal health audit. We all know that donating blood saves lives, right? But figuring out if you're actually allowed to donate can honestly feel like navigating a giant maze of medical rules. Well, today we're going to clear all of that up. We're going to put you through the blood donor eligibility funnel to find out exactly where you stand. By the end of this, you'll have a crystal clear picture of whether you can roll up your sleeve today or if you just need to wait a little while. So here is our roadmap for the Explainer. We're going to cover the basic donor checklist, check out vital signs, talk about lifestyle pauses, dig into medical history, and then wrap up with donation prep. Let's get this audit started. All right, part 1, the blood donor checklist, age and weight baselines. I want you to mentally check these boxes off your personal list with me right now. First up, you've got to be in good health, both physically and mentally. Then comes age. The standard window is anywhere between 18 and 65 years old. But if you're a first-time donor, you do need to be under 60. Now, if you're doing an apheresis donation, which is just a specific type of automated donation where they collect specific blood components, that range tightens up a bit to 18 to 60 years. And finally, weight really matters because it dictates a safe donation volume for your body. To donate 350 milliliters, you need to weigh at least 45 kilograms. To give a full 450 milliliters, you've got to be over 55 kilograms. If you've checked these off, awesome. You are successfully through the first part of the funnel. Moving right along to Section 2, Vitals and Baselines, the numbers that actually matter on donation day. Our first major clinical check is your blood pressure. When they put that cuff on your arm, they're looking for a very specific safe window. Your systolic pressure, that's the top number, needs to be strictly between 100 and 140. Your diastolic, the bottom number, has to sit between 60 and 90. What's incredibly cool to note here is that you can still pass this requirement even if your blood pressure is managed with medications, just as long as your numbers fall within that safe range on the day you donate. Okay, beyond blood pressure, there are a few other vital checks to make sure you're physically ready. Your pulse rate should be steady, no less than 50 and no more than 100 beats per minute. Your body temp needs to be a normal 37 degrees Celsius. And here is one you control entirely. You must have had adequate sleep the night before, which they strictly define as at least 5 hours. So consider that a legitimate medical excuse to catch some extra Z's. Now, let's talk hemoglobin. This is an absolutely crucial safety check, and there's a really important distinction between male and female donors here. For females, your hemoglobin levels must be at least 12.5 grams per deciliter. For males, the threshold is just a tiny bit higher, at a minimum of 13.0 grams per deciliter. They do this simple finger prick test just to ensure you have enough iron-rich red blood cells to safely give blood without feeling totally depleted yourself. Up next, Section 3, Lifestyle and Temporary Pauses. This is where I think a lot of people get kind of tripped up. Having an everyday lifestyle event doesn't mean you can never donate. You usually just need to hit pause. Enjoying a few drinks with friends or going to the dentist does not ban you from being a donor. For example, if you've had some alcohol, you simply need to wait a strict 24 hours before you're clear to donate. It's really just about making sure your system is completely clear and back to baseline normal. Dental work is actually a fantastic example of how these pauses scale based on the event. If you just get a simple filling, you only defer for a single day. Have a tooth extracted, that's a 3-day pause. A root canal bumps the wait up to 7 days, and a more invasive procedure, like getting a wisdom tooth pulled, requires a 1-month deferral. Basically, the severity of the dental work directly scales with the length of time your body needs to heal up and clear any minor bacteria from your bloodstream. Let's methodically break down some of the longer lifestyle pauses. Body modifications and major health events definitely require significant recovery and observation time. If you get a tattoo or a body piercing, you're looking at a 6-month deferral. This is simply to rule out any slow incubating infections like hepatitis. Interestingly enough, acupuncture requires an even longer pause of 12 months following your last session. If you happen to suffer a dog bite or undergo surgery, you must wait a full year before you can safely donate again. But remember, these aren't lifetime bans. They're just protective waiting periods. I do want to speak directly to our female viewers for a moment because there are specific temporary maternal and menstrual deferrals to be aware of. If you're pregnant, you must defer until 6 weeks after delivery. If that delivery was a cesarean section, the pause extends out to 6 months. You're also deferred for the entire time you are breastfeeding. Regarding menstruation, having your period doesn't automatically stop you from donating, but you absolutely should defer if you're experiencing a heavy flow or cramps. Finally, in the event of an abortion, there is a 6-week deferral period. Your body's recovery always comes first. Moving into Section 4, Navigating your medical history. It is vital to debunk a massive myth right now. Having a chronic condition is not always an automatic disqualifier. Take asthma, for instance. You can totally donate if you are asymptomatic and maintaining on non-steroid or inhaled steroid medications. You only defer for 14 days if you have an acute flare-up. Have high blood pressure or diabetes? You're generally acceptable as a donor if those conditions are well controlled by medication or diet. Even individuals with a history of cardiovascular disease might still be able to donate, provided they get written permission directly from their cardiologist.
Vaccinations follow a pretty similar logical structure. Standard shots like the flu, tetanus, HPV, or DPT won't stop you from donating right away, just as long as you have no symptoms. But live vaccines or more complex immunizations do require a wait. Zostavax for shingles, MMR, and hepatitis B require a 4-week wait. BCG and oral polio vaccines mean a 6-week pause. And a rabies shot? That requires a full 12-month deferral. Now, we do need to treat this next section with serious clarity. There are specific conditions that unfortunately result in a lifelong deferral. This isn't arbitrary at all. It is strictly for the safety of both you as the donor and the vulnerable recipient. You cannot donate if you have abnormal bleeding disorders, active heart, kidney, or liver disorders, or thyroid and mental disorders, including epilepsy. Furthermore, a history of hepatitis B or C, HIV, syphilis, or cancer means a permanent deferral. Lastly, if you are an insulin-dependent diabetic or have uncontrolled high blood pressure, you are permanently deferred from donating.
All right, our final section, Section 5, preparing for your donation.
For those of you who have made it all the way through the funnel and are eligible, preparation is incredibly simple, but it really makes a world of difference. Here is your quick 3-part checklist for the night before and the morning of your donation. Step 1, get plenty of sleep. Step 2, eat a healthy meal before you go, but you must strictly avoid fatty foods, French fries, or ice cream. Believe it or not, fat in your blood can actually interfere with their testing process. Step 3, drink an extra 500 milliliters of water and other fluids right before you arrive at the clinic.
Seriously, I really want to emphasize that last point. Water is your absolute best friend on donation day. Proper hydration makes your veins easier to find and helps keep your blood volume up, which prevents you from feeling dizzy. It sets you up perfectly for a comfortable, quick experience. And remember, the actual whole blood donation part only takes about 5 to 10 minutes.
Once you're done, the journey isn't quite over. Here are the essential aftercare rules. Do continue to drink plenty of water. Do sit down immediately if you feel dizzy. And do consider taking an iron supplement and vitamin C to help your body replenish. On the flip side, don't drink alcohol for 24 hours. Don't perform any vigorous exercise for the next 24 hours. So yes, you officially have a doctor-approved excuse to skip the gym. And don't smoke immediately after giving blood. Treat this as the final, victorious step in your successful donation journey.
Let's pull back for a second and look at the bigger picture. We've gone through a lot of rules, deferrals, and numbers today. But this strict, thorough process exists for one incredibly beautiful reason: to create a secure, adequate, and safe supply of blood. Every single drop counts. It guarantees that when a patient is in a critical situation, the transfusion they receive has a minimal risk of infection and the absolute maximum chance of saving their life.
Which brings us to our final thought. Passing this personal health audit doesn't just mean you checked some boxes. It means you literally hold the power to save up to 3 lives with a single donation. So, having reviewed the vitals, the lifestyle pauses, and the medical history, did you pass the audit? And if so, are you ready to step up and give the gift of life today?